Let's go ahead and get started. So thanks again, everyone, for joining us. We've got Dr. Sheetal with us. So Dr. Sheetal Ajmani is a physician. She's a best-selling author, host of the Essential Self-Care podcast, and she is the founder of the Radiant Living Institute. So today we're talking about mind-body practices. And why this is so important is that one thing that's often overlooked in conventional medicine, especially conventional psychiatry, is that mind-body connection. At Pacific Integrative Psychiatry, we really do try to incorporate mind-body practices into our treatment plans. Psychiatry is often focused on medication management and psychotherapy, which are both very effective and very helpful and can be life-saving for people. But we are missing that other element of the mind-body connection. And when I talk about mind-body practices, we're talking about things like yoga, meditation, mindfulness, Tai Chi, Qigong, breath work. There's a whole host of different kinds of mind-body practices. And in our practice, we've seen these things be very, very effective and even help people reduce their reliance on medications, and just to give people tools that are easily accessible, they're free, they don't have a lot of side effects. And Dr. Sheetal and I were talking about how these tools can help our patients. And there was one patient that I remember so vividly. This is early on in my career, and she was struggling with severe OCD and anxiety. And in addition to medication management and psychotherapy, one of the things that I recommended to her was alternate nostril breathing, which is a yogic sort of breathing practice. And she was a bit skeptical, but she said, okay, I'll try it. I'll try anything. I'm not feeling good. Let me just give it a go. And she started doing it every morning. And she came back to me and said, that is my favorite part of the day. It really helps me feel calm and grounded, and it sets the tone for the day. And her symptoms started to improve. And we didn't make any other changes with her other, medications and things like that. But it was such a powerful yet simple thing for her to do. So Dr. Sheetal is going to be sharing more about practices that we can incorporate into our own lives or that we can recommend to our patients. So I'll turn it over to you, Dr. Sheetal.
Wonderful. Thank you so much for that introduction, Dr. Bhopal, and for sharing that story and your experience with it and your patient's experience with it as well. And so just to kind of, before I share my screen, just to reiterate some of that, these practices can be so helpful as, an augment to conventional therapies and conventional treatments. And of course, always implement any changes under the guidance of your personal physician. But I'm going to go ahead and share my screen now and set this up into full screen so you can see my slides. And then I'm just going to open up my chat from here as well, because I do enjoy having interactive presentations, meaning I want to hear from you and I want you to participate and write comments in the chat box as we move along. So today we're talking about mind-body practices for anxiety relief. And so I thought it would be great to start with some introductions. So I will take a moment to introduce myself a little bit further. And while I'm doing that, though, I would love to hear from you in the chat box. I know we did some introductions earlier of where you're joining us from, but I would love to know more specifically as well, what led you to sign up for today's session and what do you hope to gain or learn as a result of attending this workshop? So please leave that in the chat. And while you're doing that, I'll go ahead and take a moment to introduce myself a little further as well. So as Dr. Bhopal mentioned, my name is Dr. Sheetal Ajmani. I am a trained pediatrician, have been practicing pediatrics for 16 years. And it was actually my first year of medical school back in 2002 when I personally discovered yoga, and I started attending yoga classes, and I just experienced this sense of peace that I had never experienced before. And I continued to turn to that myself personally to help manage just all of the stressors of medical school and residency. And so that was sort of my first experience with a mind-body practice. And so then I went on to, after I completed medical school, pediatric residency, I went on to complete a yoga teacher training program, and I also went on to study Ayurveda. So I am a certified yoga instructor as well as a certified Ayurveda consultant. Ayurveda, if you're not familiar, is often considered a sister science to yoga. It actually goes back as far back as yoga does in terms of when it originated. And it is a system of lifestyle practices, habits, and routines to include mind-body practices, including meditation and yoga and breath work as modalities to help you feel your best. So as the founder of Radiant Living Institute, what I do is I guide people to get unstuck and learn to live radiantly again. So what I've done in creating Radiant Living Institute is really taken over the past 2 decades of my own personal and professional exploration of Eastern and Western modalities of healing and well-being and recovery, and really brought them together in a really unique way to create my own 6-step method that I often guide clients through, as well as teaching and guiding people through mind-body practices. So that's a bit of an introduction of who I am and what makes me qualified to share this with you. And I see some introductions being dropped in the chat, so thank you for that. Just taking a peek at that. Great, love it. Okay. Okay, so I want to introduce a little bit of just kind of my general approach in Radiant Living Institute and just all the programs that I offer. And then we're going to dive deeper into specific mind-body practices specifically to help with anxiety. So 3 of my own pillars, and the pillars upon which Radiant Living Institute is built upon, is that small changes make a large impact. You'll see that as we move through this presentation as well. What we're going to do is I'm going to go over a little bit more of my approach, and then talk a little bit about mind-body practices. And then towards the end, I'm going to actually guide you through a few practices as well. So you'll see how you'll experience this yourself about how sort of small changes, small actions can really have a large impact. And then another pillar that I have is that life's challenges are actually the greatest catalyst for self-empowerment. So just kind of, I know this isn't necessarily maybe specifically the topic, but just kind of thinking about that in terms of whatever you're facing, whatever you're dealing with regards to if you have a diagnosis of anxiety or anxious feelings coming up, just realizing that all of this can also be used as a catalyst to dive deeper into understanding more about yourself, to dive deeper perhaps into these sort of self-care, mind-body practices and tools as well. And then my third pillar is that our radiant life begins from within. And so that we really kind of take a journey and an opportunity to look within to create those changes that we want to in our life. And so I came up with this CAR method, and I use this as sort of the framework for really all of my programs. And so this is kind of the journey and framework that we're going to go on this evening as well. And what that means is just kind of wherever you are now and looking at where you want to go, we need some sort of vehicle, right? So, and that could be if you're walking, your legs, or it could be a car, a train, or a bus. And so I propose that it's a car, where CAR stands for C, clarity, A, acceptance, and R, rebuilding. So that's what we're going to do around this idea of understanding a little bit more about anxiety, about mind-body practices, and then in the rebuilding phase, actually giving you an opportunity to experience this yourself as well. Yeah? Sound good for everyone? Okay. So clarity, what I thought we would do is go through just a couple of exercises. So I would love for you to, I should have said this earlier, if you don't have a pen and paper, please grab a pen and paper, because I want you to answer these questions actually. And so So the first is with clarity, is getting really clear about just what's going on. And so I wanted to use this as an opportunity and an invitation for you to kind of just take kind of a big picture look at the anxiety and just name it, first of all. Like, what are the situations in which you may feel anxious? And so just jot that down on your own sheet of paper. And if you feel comfortable, you can leave some of this in the chat as well. But just name it. And why I'm asking you to name it is because when we name something, it helps us realize that it's not who we are. Like when we're going through something, often we can really identify with it that I am the anxiety, right? Or I am anxious. But when we name it, and we can kind of in our mind realize kind of what situations these feelings of anxiety are coming up or that may be triggering these feelings, it can help us get more clarity with regards to also kind of what we're going to talk about a little bit later in this workshop of like leveraging these mind-body practices to kind of intercept what's going on there on some level. Yeah. So this is kind of just about identifying it and noticing it. And then the second question I want you to answer is, what sensations do you experience in your mind and body when you're feeling anxious? So what sensations do you experience? Like, does it feel like your mind is racing? Does it feel like your heart is racing? Does your breath feel shallow? Like, what do you feel? What do you experience? And then I'm curious, what do you do now? Like currently, what do you do when you feel this way? So take a moment to jot that down and just reflect on that. Yeah, everyone doing okay? So we're just taking some time to kind of get clear about our experience with anxiety, our individual experience with anxiety, the situations that may trigger it, beginning to notice and just observe what sort of sensations you experience when you are feeling anxious. And just getting clear on kind of currently in this present moment, like what you do when you feel that way. Yeah? So then from there, I want to go ahead and move into this acceptance phase. Now, in this acceptance phase, using this framework that I use of going from clarity to acceptance to rebuilding, like first we need to be really clear about kind of where we are, what the situation is. Acceptance is about really kind of grounding ourselves in that present moment and in that reality, because it's only from this present moment that transformation can begin to occur, right? Or that we can start to intercept that. And so part of that, for me, in my approach is starting to cultivate that mind-body connection and also starting to understand sort of the perspective of sort of what's going on in this situation, right? Like what is actually going on when you're feeling anxious? And so I wanted to use this time to talk a little bit about what's actually going on like within your physiology and your body. And so talking about that sympathetic and parasympathetic nervous systems, right? So often when you are feeling really anxious, your sympathetic nervous system is activated, right? You may be sensing some sort of danger or fear or worry ahead, right? And or in your current situation. This could be going on kind of chronically as well over extended periods of time of just kind of this chronic activation of your sympathetic nervous system, right? Your sympathetic nervous system is that fight or flight part of your nervous system, right? That's what senses, that's the part of your nervous system that senses that there's danger ahead, right? In our hunter-gatherer days, so you'll see on the slide I wrote, is there a tiger, right? In our hunter-gatherer days, that's where our sympathetic nervous system, that's where it would be triggered when you're out hunting and you would see a tiger, right? And what would happen all of a sudden, you are in this fight, flight, or freeze mode because literally your life depended on it, right? You also become like hyper-focused, right? On, addressing the danger that's going on. right? Your heart starts to beat a little bit faster. Your breath maybe gets a little bit more shallow, and you're just hyper focused and narrowed in on this tiger, right? And it, whereas your parasympathetic nervous system is your rest and digest part of your nervous system. And so when you're not in fight or flight, right, then your body knows when there's no tiger there, right, then your body knows, okay, I can relax, right? I'm in a place of perhaps safety where I can kind of let my guard down, I can rest, and that's your rest and digest phase. And what happens in rest and digest, right? Even just talking about it, I don't know about for you, but for me, even just talking about the rest and digest phase, like my shoulders are starting to relax. And I feel like my breath is getting a little bit, like I'm able to take a bit sort of deeper breaths. My heart rate starts to calm down, right? When you're in that rest and digest phase, you're also able to kind of take in more of sort of an expansive perspective as opposed to that sort of focused in when you are needing to deal with a tiger. Yeah, so that's just a little bit of kind of what's going on physiologically when you are feeling kind of these strong feelings of anxiety and activation. And so I wanted to go over that because here's where it's really cool with mind-body practices. You can actually use your, you can actually kind of intercept your physiology and leverage that to help you feel better. Yeah. So as I mentioned before, my training in mind-body practices, specifically my expertise is within things like meditation, breath work, and yoga. As Dr. Bhopal mentioned, there are also so many different types, so many other different types of mind-body practices as well. But for right now, and for this sort of rebuilding phase, so in the rebuilding phase, that's where we kind of create our plan of action, right? And so I wanted to give you these 3 options and experiences for ways that you can sort of intercept that physiology, use these mind-body practices to actually leverage your physiology and what's going on in a natural way, actually to help you feel better. Yeah, that makes sense? And so here's the thing with these 3 things that I have listed here. When you're in a situation where you're feeling really anxious, you can do all 3 of these. You can choose to do one of them, right? Really anyone will has the potential to help you. Yeah. And so I'm just going to go over them first, and then I will guide you through them. Okay. And so I know I'm also kind of specifically talking about like when you are feeling those anxious feelings of engaging in these practices, but also as Dr. Bhopal mentioned in her introduction, doing some sort of practices and even doing some of these practices when you are not already activated actually does have a cumulative effect. So, so it actually does through neuroplasticity, even, and perhaps especially even more, when you're doing it, even when you're not activated, like Dr. Bhopal mentioned her patient who was doing the alternate nostril breathing in the mornings and noticed a benefit throughout her day. It really does actually have a cumulative effect. So these are strategies that I'm going over today that you can use actually when you are activated or in a state of feeling really anxious, or you can just begin to engage in some of these as part of a daily practice. Like if you have a morning routine or during some part of your day, just to practice with it during another part of your day, just to, which does also have benefits. 1, it gets you used to the modality. 2, it also, as I mentioned, truly does have a cumulative effect, and through neuroplasticity can also kind of more long-term actually help kind of rewire some of your connections so that your mind, your brain, your mind, your nervous system, what it kind of currently may be detecting as threats starts to become a bit less reactive to those things that are not really tigers in your daily life, but that are activating your nervous system as though you are seeing a tiger. Is that making sense? Yeah. So I'm going to go through these three, I'm going to describe these three strategies, and then we will practice it. So the first one is engage. So what I mean by that is essentially a mindfulness practice. Engage your senses to shift from that focused sort of tunnel vision focused view that happens when you naturally are in that sympathetic nervous system drive to more expansive. So now what you are doing is when you're in that situation, you're intentionally starting to kind of scan your surroundings and take in what you notice through your five senses. What do you see? What do you hear? What do you feel? Yeah. So you're just beginning to sort of scan your environment and take in more of this expansive view. So you're using your conscious mind to shift from this tunnel vision focus to beginning to engage through essentially mindfulness, to noticing what's around you and bringing yourself into the present moment. Yeah, so that's one. Again, these can be done on their own or together, these three modalities. Second is breathing. Now we often hear, take a deep breath or take a few deep breaths, right? But actually, it is your exhalation that activates your parasympathetic nervous system, your rest and digest part of your nervous system, right? So a great trick and technique is to actually focus on extending your exhale slightly longer than your inhalation. Yeah. So there's lots of other sort of breathing practices out there. As Dr. Bhopal mentioned, the alternate nostril, which is also a great one. But this is one that I feel like is just kind of like the easiest to start to integrate because you're essentially taking a breath in and then just trying to extend your exhale so it's a little bit longer than your inhale. Yeah. And then the third thing I wrote here was focus on your physical body. Focus on an aspect of your physical body, again, to kind of bring yourself into grounding in your body. And so I'm going to give you some examples of what that can look like. And so one way that can look like is if you're standing or if you're sitting in a chair, putting your feet flat on the ground and just really noticing the sensation on the soles of your feet just resting on the ground. Noticing that support beneath you, noticing the floor supporting you, right? And just really kind of noticing that sensation and connecting with your physical body. Another way is kind of combining this with your breathing practice and maybe placing your hands over your heart or one hand over your sternum and one hand over your abdomen and just really noticing the rise and fall of your sternum or the expansion and contraction of your abdomen with each breath. So those are a couple of examples of kind of what I mean by starting to kind of focus on your physical body. Is this making sense? Okay, so I am going to go ahead and guide you through a practice where we'll just try all three of these and just notice how you feel. So one thing I always say is just become a student of your life, become a student of your own life. Because all of these tools, all of these strategies, we have a framework for it. And according to Ayurveda, which one thing that I absolutely love about the system of Ayurveda is that it really sees each one of us as very unique. Which means that Ayurveda gives us a framework, right, for our individual kind of constitutions and what we're going through. But then there's still so many nuances there. And so it really is about using that framework as sort of a guidance, but then becoming a student of your own life and trying something for a week or two and just noticing how you feel with it. Yeah. The other thing I want to mention that I think is really, really important before we get into practicing it, and I really want to mention it because I feel like a lot of presentations and teachers of mind-body practices don't mention it, and I think it's really important, is that when you are just starting out to engage in some mind-body practices, or even if you've been doing it for a while, actually, these practices can sometimes trigger past memories, past traumas, difficult emotions that maybe you didn't even realize were underlying there. And part of that is because we tend to hold on to and store so many of our emotional experiences within our body. And so often on the other hand, we tend to spend most of our day in our mind. And so when we're building and strengthening that mind-body connection, some of those past memories, traumas, difficult emotions can sometimes come up. And so that's where I feel like it's really important to engage in these practices under the guidance of someone, whether it's a coach, therapist, psychiatrist, like under the guidance of someone who, if you notice some of those things coming up, that you have a safe space where you feel supported, where someone can kind of guide you through how to maybe tweak these practices to fit specifically with what you're going through. Yeah, so let's just try it now. So I want you to find a comfortable seat. If you're not already comfortable in your seat, find a comfortable seat. And I do want you to plant your feet on the floor. And then what I want you to do is just begin to slowly just look around your room and just pay attention and just notice what you see. What colors do you see? What objects do you see? Maybe just starting to name them. Just looking around, what textures do you see? Continuing to just look, slowly moving your gaze around your room, identifying a few objects. Grounding yourself to this time and space. And then when you feel ready, if you'd like, you can either let your gaze rest softly on one of those objects, or you can close your eyes. And then now with your eyes closed, I want you to take your awareness to your feet. And I want you to notice your feet resting on the floor. Notice the sensation on the soles of your feet as they rest on the floor. Notice the support of the floor beneath you, the stability. And maybe allowing your feet to rest and relax into that support and stability just a little bit more. And then from your awareness on your feet, begin to shift your awareness up your legs, to your knees, to your upper legs, to your hips. Bringing your awareness to your lower back, your middle back, your upper back, and up through the crown of your head. And beginning to bring your awareness down the front side of your body. Noticing the muscles of your face, your neck, your shoulders, your upper arms, your elbows, lower arms, wrists, hands, and fingers. Noticing your chest region, your abdominal region, your thighs, your knees, your shins, your ankles. Back to the soles of your feet, resting on the floor. Being aware of that connection once again between your feet and the floor. Now begin to shift your awareness to your breath. So not changing the pattern of your breathing in any way, just noticing your breath. Noticing your inhale and your exhale. For now, just allowing your breath to come and go naturally. Now I'm going to guide you through a practice of extending your exhale slightly longer than your inhale. So I'll guide you through it, and I'll use a count of 2 and 4, meaning 2, breathing in for 2, a count of 2, and breathing out for a count of 4. And at any point, if you feel like you need to adjust that count, feel free to do so. Just try to keep your exhale slightly longer than your inhale. So let's start together. Just inhale here and exhale. And then we'll start. Inhale, 1, 2. Exhale, 1, 2, 3, 4. Inhale, 2. Exhale, 2, 3, 4. Inhale, 2. Exhale, 2, 3, 4. Inhale, 2. Exhale, 2, 3, 4. Continue on in this way. Again, if you feel like you need to adjust the count at all, feel free to do so. Just be mindful that your exhale be slightly longer than your inhale. So if you're noticing that your breath feels strained to meet the count of 2 or 4, then that would be a cue for you to adjust the count to a more comfortable one for you. Or if you feel like you are rushing to fit your breath into that count, then you may want to increase the count to something like, say, 3 and 6. So you want the breath to feel comfortable here, not rushed and not strained. And your exhale doesn't necessarily have to be double than your inhale. It could even be just 1 count longer. So continue on in this way. And at the end of your next exhale, gently release the count and just allow your breath to return to normal. Allowing your breath to come in and out. Begin to bring awareness back to your physical body. Notice your feet resting on the floor once again. And whenever you feel ready, gently beginning to flutter open your eyes. So I would love to know if you could let me know in the chat box how you feel now. How did that practice feel for you? And again, you don't need to do these 3 in a specific order. You don't need to do all 3. You can choose 1. If 1 resonated with you, I kind of combined all 3. So first we started with engaging your senses, noticing your surroundings, and then we moved into kind of a body awareness practice, and then we moved into the breath practice. So I see it was calming and relaxing. Wonderful, wonderful. All right, good. So we just did that. Definitely more relaxed. Wonderful. Definitely helped me tap into my parasympathetic. Yes, love that. Love that. So great. So I hope you can see kind of how how these tools can be used in your own practice. Lovely. Yeah, so I saw relaxing overall, noticed the crown of my head was soothing. I love that. Found that I preferred a longer count for the inhale and exhale. Okay, yeah, that's great. And it just depends on kind of where your breathing pattern is now, like what's going to feel most comfortable. So again, I've worked with clients who felt most comfortable at like a count of 2 and 4, like we did, or 3 and 4, like the 2 just felt too rushed for them. So the 3 and 4 felt more comfortable, and others where it's like 4 and 6. So just adjusting it, you just want to feel like not too rushed on either end and not too strained on either end either. So I would love to open it up for any Q&A, and I also just wanted to share a little bit about where you can kind of learn more about the work that I'm doing. And as we mentioned in the beginning, I am based in Virginia, so I am based on the East Coast. I know many of you are on the West Coast, but the work that I'm doing with Radiant Living Institute, I do offer my services virtually. So I am available to work with you wherever you are in the world. And so you can learn more about the work that I do at radiantlivinginstitute.com. And then I have my email address and phone number there to get in touch with me. And I'd love to just open it up for any Q&A.
Well, thank you, Dr. Ajmani, for that wonderful presentation. And I really like your framework, the CAR framework, and then the engage, breathe, and focus framework. I do have a question. So you mentioned that practicing throughout the day helps with the cumulative effect and the neuroplasticity. What do you recommend as far as like a frequency? Do you recommend doing a breathing practice a certain number of times a day or at certain checkpoints? Like, how might you incorporate this into a daily routine?
Yeah, that's a great question. So I'll just go ahead and stop the share there too. That's a great question. So honestly, whatever you can fit in is great. So I don't like to, I'm all about, because what we can do is sometimes we can be really hard on ourselves when we kind of find a tool or a self-care practice that we want to integrate more of in our life. And sometimes we can get a little bit hard on ourselves if we're not doing it according to like a specific schedule. So I really individualize this, when I'm working with clients. But what I would say with this is that it is cumulative, meaning even if you do, ideally you're doing a little bit of this every day, right? Ideally, you're finding a way to cultivate that mind-body connection every day, finding a way to feel grounded every day. So yes, that is ideal, right? And I generally recommend doing something like this in the morning. I feel like that is a time of day where many of us generally have the most control over our schedule and not being interrupted and that sort of thing. And you can I often will guide people to kind of set up their environment to facilitate that as well. So like if there's visual cues or if you have a specific space in your house where you can engage in your practice. So that is what I generally recommend. But I work with a lot of clients who tend to have this all or nothing mindset. I am recovering from that as well, right? Where if I were to say do this every day and they miss a few days, often it can be like, well, I missed that for this week, and then feel more challenged, feel like it's more challenging to kind of get back on track with that. And so that's why I always say start small. Maybe you start with like 5 minutes once a week, if that's what fits your schedule. Or maybe you start with like 2 minutes, 3 days a week, if that's what fits your schedule. Like start where you can. And this goes back to one of those pillars that I mentioned that I have that I mentioned at the beginning of my presentation, that small changes really do make a large impact. So even if it's just a couple minutes, it really does make a difference. And what we know about these practices that's really neat is that the benefits that you experience, yes, you benefit those experiences. I switched those words. You experience those benefits while you're actually doing the practice. But we also know that those benefits continue to stay with you throughout the day, right? And so that's powerful. But then we also know, again, that over time, so even if it's 5 minutes once a week, but say over a year, right? Those benefits are cumulative as well. So I would say find some sort of schedule with some sort of consistency, but that might look different for each of us. That might look like once a week. That might look like twice a week. Great goal is to shoot for every day, but don't put pressure on yourself to get there right away. I'll share for me, I started practicing yoga in 2002, my first year of medical school. But in terms of a meditation practice, like a sit-down meditation practice, I started when I was going through my first yoga teacher training program, which was in 2010. We were instructed to sit down and do 15 minutes a day on our own, and we had a calendar to check box and make sure that we were doing it all. And of course, my all or nothing mindset, I wanted to make sure that I checked every single day off that calendar. And it was hard. And most days I couldn't sit for 15 minutes at all. And it was more like, so I switched it for myself. And I was like, well, let me try to sit for 5 minutes. And there are days, most days that felt really challenging, right? And so I shared this because here's what I noticed. I noticed there were a couple days, there were probably more than a couple days that I missed it. But the days that I missed it, I noticed that I felt different than the days that I was actually doing it, right? And I share that because that was 2010. I was struggling to do even between 2 to 5 minutes of it as a morning practice. Now, 2023, like I have a whole hour-long morning practice. Like in that morning practice, I'm not sitting for a meditation hour, but I have a whole hour-long morning practice that includes meditation, breath work, yoga, prayer, spirituality, like a lot of things. But that's taken 13 years. But it is a daily practice, and I don't miss a day. So I share that just because it can take time. Take your time with it. Start where you are.
I have a question.
Yes.
So my question is to do with what I struggle with is that I would start my practice. I'd have my practice for a few days and I miss it. And when I get anxious, I almost take it almost as a setback, call it my conditioning, that and kind of doubt starts coming up. Does this stuff even work? Like, is this even helping me, or am I fooling myself in some way by just closing my eyes and not, dealing with whatever is going on? And I just wanted to ask, because I struggle with doubt sometimes, and then I know that it's helping me, but there's a strong part of my brain that's telling me, this is probably not doing anything.
Yeah, I think, what do you think is leading to that doubt or causing that doubt?
I feel it's mostly my conditioning, where I kind of take it. I think you mentioned something about like when you lose your practice and you get off your practice and you again fall into a time where you're anxious. I take it almost as a very strong setback, and I start like telling myself that, either I'm not doing it correctly, I don't know how to do it right, or it's not, something is wrong with me at a very basic level, that this is not going to help me.
Yeah, I think, what I would say is, and if I had a pen and paper, I actually drew this picture earlier today. Actually, I guess, well, it won't show up very well, but if I had a pen and paper, I usually like draw this graph, and it's like, our progress in things, it looks kind of like this. Does that make sense? Like it goes up and down, but it's actually always still going up, right? So it's kind of like that idea of 2 steps forward, 1 step back, right? So sometimes we can have these moments where we feel like we are having a setback, and we can feel like, well, I'm just at square one, like that did nothing, right? And I feel like that's what I'm hearing you share. And so we can have those moments that can feel like setbacks, but remembering that you are actually always moving forward. You're never going back all the way, right? It's that idea. And so maybe that sort of visual or that phrase might even help you in those moments of like 2 steps forward, 1 step back, but I'm still always moving forward, right? And then I think just reminding yourself, because you said yourself that on some level, you also do know and feel that when you are doing these practices that it is helping, that you are feeling a benefit. So just reminding yourself of that too. I feel like the greatest momentum for us to propel us to continue to engage in a practice is remembering and knowing our own felt experience with it. So knowing that you have experienced benefits from it, and just reminding yourself of that. The other thing I would say is that during different times in our life, these are all kind of building your toolbox. And I've spent, the past over 2 decades really building my toolbox of self-care tools. And who knows, I'm sure my journey doesn't end there, and I'll be learning more self-care tools over the next 2 decades. But I say that because what you need and what's going to help sometimes can change over time as well, in terms of what practice or what modality resonates with you in that moment. So sometimes it could also be needing to again, maybe meet with a guide or a coach, someone like myself, Dr. Bhopal, to just kind of tweak, kind of look at that regimen. What are you doing? And is there something that we need to kind of tweak that you might find more benefit with in that moment?
Yeah. Thank you.
Yeah.
All right, wonderful. Well, thank you so much, Sheetal. I see Josh is here. Josh, if you have any questions, feel free to jump in or drop them in the chat. Otherwise, we can wrap up there. And thank you so much for your time, being so generous with your time and knowledge this evening. I really appreciate it. And this was great. This is really, really helpful. So thanks again.
Great, absolutely. Thanks for inviting me.
All right, so I think we'll wrap up there. Yep, thanks, Josh and PJ, for joining. So stay tuned, everyone. If anyone's listening to the recording, stay tuned for our next workshop. We've got one next week. It's on June 28th, 2023. It's on nutrition for anxiety. So have a good evening. Thank you.
Bye, everyone. Thank you.
Bye.